Friends, today we're going to work on Piriformis syndrome. We'll do a set of exercises that will help you relieve and relax the area, and as a result, you'll feel better. Let's start with some stretching. You can do the exercises together with me right now. From this position, I take a step back. The right leg goes back. We lower ourselves onto the elbow, and the torso stretches forward. I inhale as I move upward. Exhale as I sit down. I should feel a stretch along the back of my thigh and in my back. This will help me warm up the gluteal area. And accordingly, the deep muscle, the piriformis, which creates tension and irritates the nerve root, it often happens that the pain is felt more on one side, so the range of motion may differ. I may not be able to lower myself all the way down on that side. Where it pulls strongly, return and try to go a little lower on the other side. Always work within a comfortable range of motion for yourself so that the muscle has time to relax and doesn't spasm in response. Good. After you've worked through it, the stretching step, we put a resistance band above our knees and we're going to warm up the muscles. To activate them, we need to engage the superficial muscles. The gluteus maximus, the gluteus medius, so that the deeper muscle, like the piriformis, can relax. I put the resistance band a bit above my knees and lie down on my side. My knees are bent, my feet are together, my neck is relaxed, and my torso is fixed in position. I will lift my knees while keeping my feet together. Raise up, exhale, lower down, inhale. Exhale, inhale. My torso must remain fixed. I don't help myself with my back. I move outward and feel the outer surface, the hip and the glute. I do 20 to 30 repetitions like this. All right, let's switch sides. Knees bent, feet together, neck relaxed. Exhale at the top. In the future, when we do this exercise, we should progress with resistance bands in order to strengthen the muscles, the glutes, so that they become stronger. And the last one. All right, I leave the band on my knees, lie on my back, back pressed down. I lift my hips up, raise my pelvis, spread my legs apart, bring them together, and lower down. My task is to lift the pelvis up using my glutes. For this, I don't push up into a very high bridge. I keep my body in a straight position, abs tight and glutes engaged. Spread, bring together, lower down. Exhale, lower down. My recommendation, if you have an acute condition, you don't have to lift your pelvis so high. Just make the movement at the hip joint. Tilt your pelvis up, lower down. Tilt, lower down. I'm just moving my pelvis, trying to activate my glutes and abdominal muscles. Exhale. Do about 30 to 40 comfortable repetitions like this, calmly at your own pace. This way, you relax both your lower back and your piriformis muscle. Here, you can also feel the gluteal muscles working well. From this position, I will remove the band and continue stretching my glutes. While staying flat on my back, I slowly cross one leg over the opposite knee. Then I grab firmly under my knee with both of my hands and gently pull it in toward my chest. I inhale and exhale, pull in and relax, stretching along the entire back surface through the glute. If it hurts, your range of motion may be limited in this position. Just hold your leg, inhale, and push your knee away from yourself, then pull it back toward you. Push away as you inhale and pull toward yourself as you exhale. Our goal is for the muscle to relax. To achieve this, you do everything slowly and calmly. This is so you don't provoke your nervous system to tense up even more in response. Good. I do the same thing on the other side. The right leg is the supporting one. I cross the other leg over under the knee and pull it in. If it's convenient for 30 seconds, we hold breathing. Perfectly. And we're also making a lighter version. The foot is in the stop. They dragged it away. Inhale, pull, breath. I'm delaying. Inhale. The back remains glued. Breath. I have noticed that my abdominal muscles are almost always feeling incredibly tense. Just take a deep breath and inhale slowly. Breath. Let's do an exercise that will help us stretch the front surface of the thigh, the muscle that pulls our pelvis forward. And when we have tension in the piriformis muscle, transversely we compensate in the front part. Therefore, we remain in a kneeling position. I take a step forward, tuck my pelvis slightly towards myself, and move my hips forward. I should feel a comfortable stretch along the front of the thigh, the muscle that rotates the pelvis forward. Hold the position, exhale, and stay like this for about 30 seconds. If I feel comfortable, I can exhale and lower myself a little further. The exhale helps the stretch here. My recommendation is not to do these pulsing movements. They will strongly irritate the nervous system. All right, let's return, come up, and switch sides. The right leg will be the supporting one, pelvis straight, tuck it towards yourself. Exhale, torso forward, keep your body straight. Again, this can be a smaller angle, but you should feel the stretch along the front surface of the thigh. And exhale. Good. The last exercise. We do it from the same position. I step forward with my foot and rest it on my knee. My hands go in front of me. The leg that's behind me is straightened with the toes on the ground. The knee is straight. I do a pushing motion back, return, and inhale. I stretch, exhale, and hold. Here we will be stretching the glute and the side surface of the thigh. But keep in mind that we've already worked out, so this kind of exercise should always be done at the end. Hold and exhale. Good. And I switch legs. The left leg goes in front. I bring the foot forward nicely. The leg that's behind is on the ball of the foot with the knee straight. I go down, exhale, and hold. Remember, spasm, it's always a protective reaction of the body. If we have tension, it means we have an overall imbalance, a muscular one. Friends, do this set twice a day within a comfortable range of motion for yourself, and may your back stay healthy.